Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. My last video was all about some classes of medications which I believe are very good. But moving on from that, because so many people ask me about the medicines that I don't like being used in my patients, specifically our older population. Well, we have a massive problem of overprescribing. I see this all the time, and it is devastating to see these massive medication lists in older people, sometimes 20 or 30 plus medications, where if somebody actually sat down and put some thought into it for half an hour or so, we could safely de-escalate probably 50% or so of the medications. So I want to focus and make a new video series on the medications that I don't like being used in older patients. And my first medication that I want to focus on in this video is hydrochlorothiazide, also known as HCTZ. That is the abbreviation. And in the United Kingdom, the equivalent medication would be bendrofluozide. And I believe it's actually now changed its name since I left the shores of the United Kingdom to bendroflumethiazide. So a much longer name. I'm not sure why they changed the name. Maybe there was some woke reason why they changed it. But all joking aside, it is now known as bendroflumethiazide in the United Kingdom. So both hydrochlorothiazide and bendrofluozide, I'll stick with the old name, thank you, belong to a class of medications known as thiazide diuretics. And these basically work by draining fluid out of the body and lowering blood pressure. And I don't like this medication being used in an older person for a number of reasons, but let me tell you about a few scenarios. A common scenario is this, and this could actually apply with any blood pressure medication. As people get older, their blood pressure often naturally drops, and they end up not needing so many blood pressure pills because then you get other side effects from low blood pressure. But I find hydrochlorothiazide in particular tends to cause more side effects and rapid fluctuations in blood pressure, issues like orthostatic hypotension, which is where when someone stands up abruptly, their blood pressure drops and they get very dizzy and they can be prone to falling. I find that issue occurs a lot. But especially in my line of work in the hospital, the typical scenario is this. Someone will get admitted to the hospital, and we will find out that they've been getting sick for many days, maybe even a week or two. They continue taking the thiazide diuretic, and they lose more and more fluid. They become more dehydrated, and when they come into hospital, they will have renal failure, their kidneys won't be working so well, and they will often have a very low potassium level, what we call hypokalemia. And this is a very common side effect with thiazide diuretics, can even happen as an outpatient. This is why lots of people who take them, especially older people, they have to also take a potassium supplement. Go figure. How typical is that? We prescribe a medication to help with one problem, and then we prescribe another medication to help with the side effect. But there are lots of alternatives to thiazide diuretics. And if you take one, or you have a loved one who takes one, I'm not telling you to stop it abruptly. Don't do that, and it would be irresponsible of me to suggest that without being your doctor. But you should certainly speak to your doctor about an alternative, assuming an alternative blood pressure medication is necessary. And what I would do personally, if I had anyone in my life, a loved one, who took a thiazide diuretic, I would be trying to get them off it. And if they need a medication for blood pressure, there are lots of other alternatives available. Beta blockers, which I talked about in the last video, ACE inhibitors is another category of medication. There are lots of them out there, but I would be really trying to get my loved one off a thiazide diuretic. I do not like that medication, and my own personal experience with these medications, especially in an older age group, is that they cause lots of issues. So do remember that. That is the point of the video. My number one medication, which I don't like seeing used in an older population, thiazide diuretics, hydrochlorothiazide in the United States, and bendrofluozide or bendroflumethiazide in the United Kingdom. Thank you everyone for listening. Feel free to comment down below. Do you have any experience with thiazide diuretics? Do you have a loved one who is on a thiazide diuretic? Again, I stress, if you are on one or a loved one is on one, speak to your doctor about possibly changing it. Maybe you've been on it for many years and you're completely fine. That's okay, everybody is different. But do make sure that you're not getting any side effects like these rapid fluctuations in blood pressure or low potassium. That is the major side effect that I see all the time with thiazide diuretics. Dr. Suneel Dhand, thanks everyone again. Check out my Real Health Academy and my Uncensored platform. Those links are down below. Hit the like button if you like this video and the bell button for more similar videos in the future. Take care everyone, and we will speak again very soon.